Well, hello and welcome, members of the Chinese Medicine Practitioner Meetup Group, hosted by Kamwo. My name is Thomas Leung. I'm the organizer and your host for this afternoon or evening, depending on where you are. I want to take a moment to welcome new members to our group. I hope you enjoy what we have for you today, and hopefully many more events in the future. The mission of our meetup group is to connect members with respected authorities on subject matters within our profession. The events are always free, and our speaker suggestions come from you, the members. So if you have suggestions for speakers, please send them to us. This is our 130th event, but it's actually only our 8th one that's exclusively online. And for those of you who are big fans of the live meetup events, the ones in person, we will most likely incorporate, that would definitely come back and definitely incorporate the streaming aspect of it, because it just could reach a lot more people. So it'll come back, but we'll definitely add the live stream. For attendance purposes, if you can just send an email at your convenience to events@kamwo.com. So you can just send an email that's for attendance, and someone on the other end will send you a $20 coupon to Kamwo's online store. And don't forget, if you don't have time now, I'll remind you at the end of this talk. Tonight's talk will be approximately 1.5 hours, about an hour and a half. So we'll end about 8 p.m. Eastern Standard Time, and wherever you are, you do the math. California, I think it'll be 5 o'clock, right? So here's some ground rules. Please mute your microphones and hold off on questions until our guest speakers can give you the cue to ask the questions. But if something is relevant, you can always type it in the chat box and then just press the button to raise your hand. And when we get to those right away, if they're relevant, something that was missed or whatever. But if not, then if you can just wait until the question and answer session toward the end, and your question would definitely be answered. Now it's my pleasure to introduce our guest speaker this evening, whose reputation in the profession precedes her. Dr. Shellie Goldstein is widely considered one of the worldwide experts on cosmetic facial acupuncture. She's the author of Your Best Face Now: Look Younger in 20 Days with the Do-It-Yourself Acupressure Facelift, and creator of Touch and Glow, the Do-It-Yourself Acupressure Facelift Kit. As a leading authority and educator of cosmetic facial acupuncture, Dr. Goldstein founded the Academy of Advanced Cosmetic Facial Acupuncture, which has recently partnered with Pacific College of Health Sciences to present the facial applications of Cosmetic Enhancement Training Program, aka the FACE program. And I understand that this October you'll be in San Diego in the Pacific Symposium, and
yes,
and you'll be the school will be promoting this program as well. So anyway, without further ado, we turn it over to our esteemed speaker, Dr. Shellie Goldstein. Thank you.
Thank you. Thank you so much. Thank you, Kamwo. Thank you, Thomas. It's a pleasure to be here, and I'm delighted to be able to participate in the meetup groups. As you know, I specialize in cosmetic facial acupuncture. So today's presentation called FaceTime, Diagnosing and Treating the Aging Face. So we're going to look at aging and treating and diagnosing from both the Eastern medicine perspective, or TEAM, traditional Eastern Asian medicine perspective, but primarily how we integrate that into the Western anatomical and morphological changes that occur over time. So let me get started here. When we think of cosmetic acupuncture or facial acupuncture, we think of it as maybe being very modern or very new, something trendy, but in fact, that's not the case. It stems from Myron, which means beautiful appearance. It was and continues to be a holistic regime practiced throughout Asia for centuries. And it's designed to do a number of things. It's designed to promote systemic health and well-being and delay the visible signs of aging. So it was generally considered a service that would be used by both acupuncture and herbal medicine, both topical and ingested, by the emperors to keep their concubines looking beautiful and healthy, and by the empresses to maintain a youthful, radiant appearance. However, I am pretty sure that there were multiple variations of my rung regimes utilized in most households. When you think of Asian culture, their skin is lovely. It's very pure and luminous, and it's just gorgeous. And they take care of it from as being part of their inherent culture and in part of being a daily regime that they partake in. Today's modern application of my rung is usually used as an alternative or an adjunct to facial neurotoxins, volumizers, and other appearance enhancing services. And you can look at the images on either the top or the bottom. The top is usually the before, the bottom is usually the after of the treatments that we perform. And you can see that it's not a huge, very tight facelift, but in fact, it's really what we call a healthier, tighter, brighter, natural look and feel. We know that from the perspective of aging and treatment from a teen perspective, that and just life in general, that although part of the intrinsic or extrinsic mosaic, aging is inevitable. It's not gonna, you can't stop aging, but you can, in fact, with acupuncture and herbal medicine, you can delay those signs and alter them in the moment. So that's what we're trying to do. That's our target goal. And we know from our treatments that a single treatment can yield short-term benefits, and what I mean by days or maybe a week to 10 days. And so we perform these services as a series of treatment, on average 10 to 12 treatments once a week. And in that case, we can maintain the effects of treatment, we can hold it for longer. And then we use maintenance treatment on average every 4 to 6 weeks to maintain the benefits that are received throughout the series. And when I speak to my patients, I say, it's like taking your face to the gym. They bulk up their muscles, they work out. Well, after the first day, you're not going to have tight toned muscles, you're gonna feel sore. Also, it takes time. You have to build it up. You have to have repetitive times at the gym, and then you begin to see the benefits of your hard work and labor. This is the same with face. It's taking your face to the gym. You do the series, you maintain it, and then you get the benefits of your efforts and our efforts as practitioners. What's nice about specializing in something, whatever it is, but for me, facial acupuncture, is your patients come in with a subset of symptoms. For us, on the forehead area, patients are going to talk about wrinkling across the forehead between the eyebrows. On the eyes, they're going to talk about eyelid ptosis. That means that's hooding of the upper lid over the eye area, or maybe a dropping of the brow. Swelling or darkness under the eye, and again, creasing not just between the brows, but around the eyes and on the sides and under as well. And then in the cheek area, our patients will talk about skin wrinkling, skin sagging. This fold, the nasolabial fold, is that fold between the side of the nose and the corner of the mouth. That gets more prominent with age. And then around the mouth and the jawline, our patients come in with complaints about wrinkling around the mouth, creasing around the mouth, say above the lips or on the sides. Marionette lines are those lines that run from the corner of the mouth to the jaw area. And the mental crease, that's this little crease that occurs. It's a horizontal crease halfway between the lower lip and the top of the jaw area. And then just general loss of definition along the jaw area itself. Additionally, what patients will talk about is the neck area, skin sagging around the neck, platysma banding, those bands that occur in the neck area. And then they'll come in with dermatological conditions, acne, rosacea, hyperdyschromia. Those are the sunspots that you see on people's face, generally related to the sun. And we know that as professionals in specializing in cosmetic facial acupuncture, that we can make significant visible changes. We can see softening of deep wrinkles. We can see the elimination of the very small fine lines. We can see skin tone and laxicity start to lift and tone. We can certainly see an improvement in muscle tone. We can correct and heal skin problems. And in general, the skin looks more even, the texture is smoother, the color is more bright and luminous and lustery, and then just an overall appearance in vitality. And that happens because we are affecting the internal to adjust the exterior. So internally, what we're doing is we're actually improving muscle integrity. We can thicken thinning atrophic tissue. We can improve, because we know that as specialists, as acupuncturists in general, we're not just working on the physical level, we're working on the mental level, the emotional and the spiritual level as well too. So internally, we are improving physical well-being, mental well-being, emotional well-being, and we're doing that by adjusting the channels, the organs, and other systemic imbalances. In 1996, in the International Journal of Clinical Acupuncture, this was the very first landmark study that was published in a respected journal. And in this particular study, there were 300 cases treated in China with facial acupuncture. And it was noted that 90% of the people that were treated had a marked effect with one course of treatment. And when I say marked effect, what I'm referring to is benefits in skin texture, skin color, skin elasticity, wrinkle reduction, and just an overall rejuvenation of the complexion. And not only was it directed at the face, but they were also the entire body. So again, what we're doing is we're using the principles of Eastern Asian medicine to treat the entire body and the organ systems, as well as the face. And we do this because we know that we're using, like our medicine, we're using a whole body approach towards aging. So in fact, what we're doing is we're supporting the patient's foundation, even when the wrinkles or other facial concerns are the chief complaint. And we know this because we know from our medicine that the expression, or what we see on the face, is directly related to our internal health and well-being. So we are looking at the energetic pathways, we're looking at the meridian systems, we're looking at the organs, and we're looking at the imbalances in our internal system, whether it be the digestive tract, the circulatory system, the reproductive system, the neuromuscular system, respiratory. And we're looking at them in relation to what we see on the face, and they're directly related. So for example, we know that in the spleen system, we're looking at muscles. The spleen system is responsible for the muscle tone in our face. And so you think of the stomach channel that runs straight down from the center of the eyes, down around the corner of the mouth, sliding up the side of the jaw area, and then back up to the stomach 8 area. Well, that's the entire cheek area, and that's entire muscle tone. So people who have sagging cheek muscles, we're gonna look at the spleen system. We're gonna treat the spleen and the stomach, because we know that the sagging or the wrinkles or whatever it is that our patients are coming to us for, that is just the symptom of what we're calling, what we know is our underlying pattern of disharmony. And that's very important to remember, because we are acupuncturists and we are using acupuncture and we're using the principles of our medicine to treat facial rejuvenation and tone and lifting and toning the face. So we're going to treat the root patterns with body parts, with body points, and then we're going to treat the branch systems, the face points, with corresponding acupuncture points, possibly motor points, possibly ashi points, or any other point on or off the meridian that correlates to the underlying pattern of disharmony that we get, that we glean through our tongue diagnosis, our pulse diagnosis, and our general intake. We have our Chinese medicine, we have our ability to determine our underlying pattern disharmony. We are going to correlate it with the symptoms that our patients are coming into on the face. And then with the knowledge of understanding the Western anatomical component, we can have extraordinarily effective results. So the effectiveness of the treatment results really reside in the understanding of the relationship between our team medicine and then also understanding the biomedical anatomy with regard to those morphological and psychodynamic changes that occur over time. So let's take a look at that, because this is not something that we generally get in our Chinese medicine learning. Let's look at the face, and we're going to look at it from the bone, the skeletal tissue, all the way up to the very surface of the skin, which we look at when we're looking at somebody else or ourselves in the mirror. So we're going to work from the deep to the surface. And just to note that when we are analyzing the face with regard to each of these changes or each of these anatomical relations, we're going to divide the face into planes. From the top, we're going to look at the upper face. And when we talk about the upper face, we're looking at the hairline, the top of the hairline to the intercanthal plane, which is right at the eyebrow level. That's known as the upper face. The mid face is the next level down, and that is from that intercanthal plane to the subnasale, so right underneath the nose area. And then the lower face, when we talk about the lower face, we're looking from that intercanthal plane to the chin area. So we're going to look at it from a horizontal perspective of the upper face, the mid face, and the lower face. And then we're also going to look at it from a vertical plane. So we have the vertical center line that runs straight down the middle of the face. And then we're going to divide that into different layers on the outside. The next one will run from the top of the forehead area through the center of the pupil down to the jaw area. And then the third plane, vertical plane, is going to run right in front of the earlobe. So we're looking at that from the horizontal plane and from the vertical plane. And as we age, this is the significant change that occurs. With a younger face, and you can look at this face, you can see that the weight of the face is high. It's up by the cheekbone. So you have the upper mid area right at the cheekbone is nice and high and lifted and pulling outward. The eyes are nice and open. The forehead is nice and open and lifted. And when you look at someone, a younger face, where does your eye directly go? It goes directly to the height of the face, which is this upper mid area. However, as we start to change, that plane starts to shift medially and downward. So now the weight, the forehead starts to shorten, the weight of the face moves from the outer upper area down to the lower face, immediately into the center area, or immediately into the vertical plane, running right through the center of the eyelid or the eyeball. So what happens when you look at a face of an older person? Here's the weight. The weight is at the lower portion of the face. And so our patients will say, I look like my mother or my father or someone that's older, and I look so tired, and my face looks heavy. Well, in fact, what they're referring to is just the shift of the perspective, moving from the upper mid third and the outer aspect of the ear area to the medial aspect through the middle portion of the center of the nose to the center of the eyeball, and then medially into what we're calling the nasolabial fold and that mental crease. And so they become thicker and heavier. And then over time, you can start to see this. So you can see here to the left is a younger face, wide open forehead, high cheekbones, sculpted jaw area. And as we age, the forehead starts to shrink, start to get creasing across the brow, between the brow. You can start to see a flattening of the mid-face area as everything starts to move medially into the lower aspect of the of the chin area. And then you start to see loss of definition. When you start to lose loss of definition, and then you start to see particular loss of definition in the neck area. And so why does this occur? From an anatomical and a structural perspective, what we see is the skull. The skull starts to change. The skull is made up of 22 bones, 8 cranial bones, 14 facial bones, and they're connected by little sutures. And there's one floating bone called the mandible attached to the maxilla, the frontal bone, the nasal bone, and the rest of the skull. So this is the one floating bone. What happens as we change, as we age? Well, this is a CT scan of a female on the left. She's between 20 and 40 years old, and then a skull of a woman over 65 to the right. There's a significant change that occurs. First of all, the entire height of the face starts to change. So as you can see in this image, it's a very strong, vertical, large set of bones. As they start to age, you can start to see the entire structure of the skeleton start to shorten. Then the bone itself starts to break down. It's called resorption. And as you can see in this area, the breakdown of the resorption of bone actually happens at the bone edges. So it's going to happen at the eye area. So the eye socket is going to start to expand and get larger. The temporal hollowing of the cheek area starts to break down. This cheek area, you can see in here, the dark area shadows where it's breaking down. The nasal piriform, so here's the nose, the nasal piriform starts to widen. Why? Because the bone is starting to break down in this area. The maxilla, the upper bone, and the mandible start to resorb. So you can see the edging of this mandible starts to break down, as well as the edging of the maxillary bone. When that happens, the teeth right in here start to push out and buck out. And then the face actually begins to change shape. So this face going from, whoops, sorry about this. This arrow you can see starts to move here. So this whole area starts to shift and move forward and protrude outward. So that's a significant change. That's the bony structure of our face. So what happens? I'm going to go back one more time. When these changes start to shift, all of the tissue that's piled on top of the bone starts to drop down, sink in the areas that open, and drop down as the structure of the bone can no longer support all of the tissue on top. And that deepest layer of tissue are the muscles. We have 2 sets of muscles on the face. We have deep muscles, and you can see them right in here. They're the ones primarily associated with opening, closing the mouth, and chewing. And then we have a number of very, very superficial muscles, all of these little fine, flat muscles that make up the muscles of expression. So those muscles of expression, they're called mimetic muscles. And they are different than the muscles of the deeper muscles of the face and the muscles of the body. So deeper muscles of the face and of the body are designed to move bone. Think of it when you flex your arm, what happens? You're flexing your bicep and your arm, the lower portion, the bones of the lower portion of your arm start to move forward, relax it, and they move down. Well, in fact, the superficial mimetic muscles, they are not attached to bone. They're attached from muscle, bone to muscle, muscle to muscle, and muscle to skin. So when those muscles contract, what happens? They're going to move the skin. And that's why we call them the mimetic muscles or muscles of expression, because all of the expressions that we make are designed to be made because of the movement of the facial muscles and the mimetic muscles. So here they are. These, you can see them. This is a cadaver. And again, there are some images of cadavers in this in the presentation. So let's just have a healthy respect for those people that have donated their bodies to science. We really appreciate it. On this dissection, what we've done is reflected or pulled back the skin. And so these are the muscles, the mimetic muscles, those very flat striated muscles that this is called the orbicularis oculi. It's the muscle that surrounds the eye. It's responsible for all of the muscles, the expressions that we make with our eyes. This is a muscle right here, the frontalis muscle. This is a little muscle right here. This is a muscle right here, the zygomatic muscle. This is the orbicularis oris. It's the muscle that surrounds the mouth. And all of those mimetic muscles are somehow attached from the mouth, the orbicularis oris, to the orbicularis oculi. So you can start to see, here's a little muscle right in here, the darker area, are all of these muscles that attach to themselves and to one another. This little muscle right here is what pulls the corner of the mouth down. It's attached to the muscle of the neck, this huge platysma muscle of the neck. When we tighten our neck, what happens? We're pulling down on this muscle, it pulls on this little muscle, and it pulls the corner of the mouth down. So all these muscles are interrelated with each other. And then when we make expressions, so these muscles are what make expressions, but then also when we make those expressions, it's going to affect other muscles as well. So when we purse our lips together, we're pulling all of the muscles of the cheek area, pulling them together. And then what happens is it affects the neck muscle and the other muscles of the face. So the muscles are very important. And as we age, we think of muscles in general as we age of atrophy. Well, in fact, that's not the case with these mimetic muscles. Because these muscles are constantly moving, constantly making our expressions, rather than atrophy, they're not going to get weak from lack of use, but they're going to what we refer to as attenuate. And attenuate means that they get shorter. They basically dry out and get stiff and short. So their movement is reduced. They begin to stiffen and straighten. And when that happens, we can't make of our expression. So when you look at an aging person, so someone say in their 80s or even their 90s, it almost looks as if they're not making a lot of expressions. The only thing that's happening is their mouth is moving and their eyes are opening and closing. And part of the reason for that is because those muscles have attenuated and they're in a permanent state of contraction or positioning. Now, when that happens, what happens is the muscles are underneath the skin, then the skin starts to fold too, and the skin starts to wrinkle, and you begin to get asymmetry of the face. So you've got the bone, which is the primary structure. You have the muscle, which controls all of the movement of the face, particularly the mimetic muscles. And then on top of that, we have what's referred to as the integumentary system, and that's our skin. So the skin there's 3 layers of skin. There's the subcutaneous layer, which is where all the fat cells, we have 2 layers of fat cells on the face. This is the primary area, the deep fat area, that creates the support and the structure of the skin and the integumentary system. The dermis is the health of the skin and the integumentary system. And then the epidermis, epi meaning on top, and it's the visible skin that you see when you are looking in the mirror or looking at somebody else. And so in fact, that epidermis is a reflection of what's underneath in the dermal layer. With the fat compartments, let's start at the fat area. We think of possibly fat being just this thick layer of fat that gives us cheeky cheeks and full faces, but in fact, these the fat on the face is divided into compartments, and those compartments are separated by ligaments. And as we age, what happens is, you see, this is a healthy face, lots of plump fat separated by the ligaments. Well, look what happens as we change. Again, the fat provides the volume and the stability of our face. And over time, we say that fat descends and deflates, meaning that it breaks down and it moves in positioning of the face. So these changes occur all over the face. And the upper area and the glabella area, glabella is right here. The temporal area, the malar area is right in here. It starts to break down. And if it doesn't break down, it's going to move. So it's going to start to move actually into medially, because remember, everything's moving medially into the nasolabial fold and along the jaw area. So oftentimes what we see with an aging adult is the flattening or a hollowing in the mid cheek area and on the side of the face and on the top of the forehead area, but the very thick, plump structure between the nose and the mouth, the nasolabial fold, nose to mouth, mouth to jaw area, and then along the jaw area, which also accounts for some of that loss of definition that we see as we age. And then we have the dermis. So this is the dermal layer in the middle. The dermal layer is filled with fluid, hyaluronic acid, proteins, and nutrients that are bathed the cells. So cell development starts at the base of the dermal layer and starts to move up to the surface, up to the epidermis. And as these cells grow, they are bathed in hyaluronic acid. They're fed lots of nutrients and vitamins and minerals. We also have in this area, we have all of the erector pili muscles. You know, when you get the chills, the hair on your skin starts to stand up. That's related to this erector pili muscle. We have sebaceous oils and glands. We have sweat glands. We have a number of different things. We also have a lot of pigment cells, and we have a lot of other things that help us to maintain health in the skin area. And then we also have pain receptors. There are all of these in here. And then as it's layered from the bottom to the top, it's also layered in this structure of different types of collagen and elastin and hyaluronic acid and fibroblasts. So it's the different layering. The loose meshwork of connective tissue is on the top, and the connective tissue is filled with, I'm going to say it again, hyaluronic acid, collagen, elastin, fibroblasts. So when we talk about needing more collagen, you know, the collagen in our face is breaking down. Well, it's in two layers. At the very top is a very loose mesh network, and then underneath it's a little more thicker. It's called the reticular layer. It's a little thicker and it gives that dermal layer more support. So you have a thick layer of support in the bottom and then a looser layer as it starts to move up into the epidermal layer. And then on top, we have the epidermis, and the epidermis is divided into five primary areas. And again, remembering that the health of the cell is moving up from the base of the dermal layer. By the time it reaches the epidermis, right? So this is still the dermal layer. As it starts to move up, what happens is the cells themselves, these are individual cells, they start to lose their moisture, lose their integrity, lose their nutrients. And as they move up through the surface, they begin to flatten, dry, and die. So in fact, what we're looking at is the very surface of our skin is healthy skin and a lot of dead skin too. So for those of you who talk about exfoliating our skin, well, that reason why we do that is to actually remove those dead cells that are sitting on top of the surface of the skin to make room for healthier cells that again are going to move up and die off. And it's approximately a 25 to 30 day cycle, except when we age. What happens when we age is we start to lose that ability to produce healthy cells. So cell turnover starts to slow down, which means that the cells don't turn over as quickly. So they're going to die. They're not going to be as healthy. You're going to sit on the surface a little more longer. The collagen that, remember we talked about the connective tissue in this area, we get a breakdown of collagen and elastin. It tends to get disorganized. And when that happens, the plumpness of that dermal layer starts to sink in, similar to, say, a mattress. Think about a mattress that it's brand new, it's nice and plump and firm. And over the decades of time that you sleep on it, it starts to pit. This is your skin. You lay on it over and over and over. It gets worn, and it's the collagen or the stuffing of the mattress starts to wear down, break down. Same thing on the face. So our skin loses its plumpness. The epidermal layer starts to separate from the dermal layer. It gets thinner, and then we start to see drying of the epidermis, and then it starts to pit like this. And so oftentimes we may think that what we see, particularly on the corner, right on the outer edge of the mouth area, that little denting that we see, we think of that maybe as the beginning of a wrinkle, but in fact, it may just be loss of collagen or disorganization of collagen and elastin. The structure that we talk about that's holding everything together is called connective tissue. And connective tissue supplies and provides that structural and mechanical support for all of the tissues, all of the organs, all of the systems, both internally, but also on the face. And it also is important for mediating the exchange of nutrients and waste between the face area, moving out of the surface of the skin, but also within as well. We have loose connective tissue, was that upper layer of the dermis that we talked about. And then there are two types of dense connective tissue. So there's regular and irregular, and they each serve different purposes, of which we won't have time to get into today, but just to know that they exist. Now, fascia. Fascia is the most abundant form of connective tissue in the body. And it's really what surrounds the bones and the vessels and the nerves and the organs. It connects everything together, but it also connects the muscles to the surface of the skin. It looks like this. So this is magnified under 25 times power under a microscope. And it's kind of slimy and sticky, kind of like mucus. But also the way that it works is it's like cellophane or saran wrap or sticky film or whatever you call it. That stuff you put over your bowl, stick it on, and it acts as a barrier to protect what's inside. But it also, the stickiness that sticks to the side of the bowl attaches whatever it's attaching it. So it's going to, in our situation, it's going to attach muscle to the surface of the skin. And in fact, that's exactly how muscles work. It's the muscle moves that's attached to the fascia. The fascia is attached on the other end to the skin. So the muscle moves, and then it allows the skin to move as well. So deep fascia is what protects and divides the muscles. We talked about deep muscles and superficial muscles of the face. So the deep fascia is actually going to divide and separate those deep muscles. Whereas the superficial fascia, it's a system known as the superficial muscular aponeuromeric system, or the SMAS layer, is what connects the muscles, the mammalian muscles, to the skin to transmit and amplify the activity of facial expression. And in fact, and again, what happens when we age, it starts to dry out and not be as sticky or resilient. So that contributes to the attenuation of muscles in our face. And what's really interesting about that is there's a lot of evidence to support that when we insert an acupuncture needle through the tissue into the fascia and we manipulate the needle, it's that sense of duchy that we get is actually a spreading of that sensation through the fascia and throughout the rest of the system. So in fact, that there are anatomical observations of body scan data that actually demonstrate that when you put the needle into the surface of the skin and you rotate it, that the duchy is actually the the spreading of that sensation through the physical substrates into the organ and the organ systems, if we're doing it in the meridian point, or throughout the meridian into the local area, but also into more other areas that are not localized in the area of the needle insertion. And we know that acupuncture, if you have a stomach ache and you put a point in stomach 36, well, guess what? It affects your digestion. And we know that there is some type of connection that allows you to put a needle in a distal area, and it's going to support the area that correlates with the specific acupuncture point. And so in fact, that is why when we are treating our patients, it's very important to understand the underlying pattern disharmony and being able to treat the body as well as the face. So treating the body, treating the underlying disharmony to support the surface, or whatever we call as the surface treatment, which is in fact what our patients are coming in for. It's no different than what we do as regular acupuncturists or non-specialized acupuncturists. And there's so much information to support needling and changes in the way that we needle on the face. Remembering that the face is very, very shallow. So if you were to take your finger and you press on your forehead, you're actually feeling your bone. On your cheek, is very light pressure, and you're actually at the bone. So the layering of skin and all of the different layers that we just referred to are very thin. And so when we are needling with facial acupuncture, we need to take into account how superficial each of these layers are, how small and thin the skin is, and how narrow and the mimetic muscles are, and how easily it is to actually get to bone with a needle. So we need to take that into consideration when we're needling. And what we're doing is actually supported in the Ling Shu. So we know the Ling Shu is that classic text for Chinese needling technique and therapy. And throughout the Ling Shu, there are numerous discussions about needling guidelines specific to the layers of the skin, the flesh, the area between the skin and the channels and the muscles, and at the level to bone. So at each of those layers, there are references. And we also have learned in the Ling Shu in chapter 1, it talks about the skin, the flesh, the muscles, the tendons, and the meridians occupy different places in the body, and that different diseases respond to different methods of treatment. And in this situation, when we talk about diseases, what we're referring to in our world are the wrinkles, sagging skin, loss of muscle tone, resorption of bone, that type of thing. And then in chapter 7 in the Ling Shu, it says, if illness is superficial and needling is deep, it will penetrate and injure the good flesh. If illness is deep and needling is superficial, then the results would not be obtained. So there's clear information about how to needle in the Ling Shu. And for those of you who have never read it, I highly recommend it. It's so fascinating because we learn things in acupuncture. And I know when I went to school, reading the Ling Shu was not one of the requirements. So decades later, I go back and this started when I was teaching. And I started teaching and I go back and I'm looking at the Ling Shu. I'm thinking, oh my, here it is. Here's all the information that I've learned. It was a light bulb. It was really a wonderful, wonderful realization. Probably should have been one of the required readings in school. Okay, so when going back to the face, when we talk about one of the ways that we can direct the treatments specific to the layers of the face, there's two of them. One is the angle of insertion. And when I talk about angle insertion, I'm talking about how the needle is positioned relative to the surface of the skin. And then the second item is the length of the needle, which we will get into. So initially, if we are going to treat, say, the epidermis or the dermis, we're going to actually lay that needle very superficial to the skin, almost like Japanese needling, where the needle is so superficial that sometimes it actually lays flat on the surface of the skin. If we are going to needle into the fat area or the hypodermis, then we're going to angle it just slightly higher, say 15 to 20 degrees relative to the surface of the skin. And then if we're going into deeper channels, say the muscle, we're going to go at a 45 to 60 degree angle relative to the surface of the skin. And if we're going to the bone or also the meridian, then we can needle directly at a 90 degree angle, because we actually want to address all of the different layers of the skin when we're looking at a meridian point. So the question then becomes, when would you use each of these types of needling? So if we are needling into the bone layer, really it's difficult once someone's bones have started to resorb, it's difficult to build them back. So prevention and preservation are key for bone level layer needling. So you're probably going to do more bone layer needling if on a younger patient, or if there is some type of injury, whether damage to the bone, then you might do bone needling. Or if you're treating something that requires you to actually get in that deep. So TMJ is an example, TMD, or any type of bone related disorder. Also, if you're doing a TCM meridian treatment. And there's a lot of research to substantiate the effects or the efficacy of needling at the bone level. We know from our research that acupuncture targets osteoblast proliferation and differentiation, and it does that by stimulating the mesenchymal stem cell precursors. And then if we are, and there are many, many examples, I'm just pulling one from the research data. If you're needling into the muscle layer, it's really good for prevention. So we're needling at that 45 to 60 degree angle. We would use it for prevention of muscle attenuation, fascial adhesions, remembering that the fascia runs between the muscles and the skin, but it also runs deeper to wrap the muscles and protect them. So any type of fascial adhesion that you may be treating, you would use at that level of 45 to 60 degrees of depth of insertion. Wrinkles. In Chinese medicine, wrinkles are oftentimes related to muscles and muscle changes, or any type of congestion in the muscles or the channel. And then again, for injury, for any type of muscular related disorder or damage due to muscle tissue. And then we also know from research that acupuncture down-regulates genes involved in muscle breakdown, and it upregulates protein synthesis. So most of our muscles are made up of protein. So acupuncture helps to upregulate the synthesis of proteins that support healthy muscle tone, and then it down-regulates those genes that are involved in muscle breakdown or attenuation. And then we also know, remembering that the muscles are underneath the skin, the surface skin, and acupuncture restores facial elasticity by restoring those resting mimetic muscles. So as it restores and helps to keep them lubricated and healthy and elastic, it's going to also affect as those muscles start to lift and stay lifted, it's going to actually restore the elasticity of the tissue on top as well. And we're going to look at that in just a minute. And then epidermis and dermal needling, we at that 5 to 15 degrees, very surface, almost laying the needle flat on the surface of the skin. There are quite a number of pain receptors, anti-inflammatory receptors, and itch receptors in at the layering of the dermis and the epidermis. So you can actually help people deal with pain for any type of painful idiopathic or trigeminal neuralgia type of pain. Needling in the very surface of the skin is extraordinarily helpful for decreasing pain. But then it's also helpful for conditions like acne, rosacea, dermatitis, and then even wrinkles. So let's look at that. We know from the research that acupuncture helps to eliminate trigeminal neuralgia symptoms and other forms of facial pains with a very high cure rate and total effective rate for mitigating the pain. We also know that there are quite a number of clinical trials and case reports of patients using acupuncture for treating atopic dermatitis, itch, urticaria, herpes at various stages, psoriasis, acne, melasma, hyperhidrosis, and for promoting wound healing. So there is so much research related to the efficacy of acupuncture in the field of dermatology. And then again, wrinkles. When we insert a needle into the surface of the skin, it actually creates a microtrauma in the surface of the skin. And then it starts a wound healing cascade, which releases growth factors, fibroblast activity is what it really is, to stimulate the production of and deposition of healthy collagen and elastin in the dermis. So we actually can needle at the local area of dermal collagen loss, and we can do it off of the area too, to actually improve collagen and elastin and thicken it in the dermal layer of the skin. And then I want to go back to that acupuncture enhances facial elasticity. It was an open label, single arm pilot study, which is okay. I mean, it's just the beginning of what comes, and there's been a lot since then. But what this author was saying is that they're restoring the mimetic muscles to increase tone to affect the face. But look at this. This is from that particular research piece. And what they did and the way that they measured this, which I thought was pretty good, is a very objective measurement. They used a moire topography. And so 1 is before and 5 is after. And they took pictures of the face with a digital camera. And an independent evaluator actually drew the circles around the area of concern. And if you look below, what you also see is as the skin starts to sag, you see the folds in the skin right here and the pitting. And over time with acupuncture, what you begin to see is this area gets tighter and tighter and tighter and tighter. So my guess is that as a single arm pilot study, what they are noting is that yes, the muscle, you may get some improvement in muscle tone, but I'm pretty sure that they're also getting thickening of collagen, thickening of elastin, which actually again lifts and tones the appearance of the face. So there's a lot more to go, but I thought that this was pretty telling of the changes that can be made. So let's talk for a moment about the needles, and then I'll get some questions in there. So needle safety. So when we are looking at the needles, we are extraordinarily careful about the needles that we use because we are needling the face. So we are looking, well, I and most facial acupuncturists tend to be very selective about the needles that we choose. So we're looking at the material, we're looking at the manufacturers in terms of material, the quality of the needles, how sharp the needles are, what is their sterilization method, how are they packaged, what's the packing facility, how clean is the packing facility, and how are those needles handled in the packing facility, and then what is the quality control standards at each level of the manufacturer. So we've done the homework for you, we've done the research, and Kamwo carries all of the needles that I'm about to talk to you about. But again, if you were to look at a magnified tip of a needle, so not all tips are the same. So even though it may look like, sort of the same here, look at this one, it's magnified at 2,000 times. This is pretty scary, right? This is not something that you might want to put in your patient's face, because if it's honed and nice and sharp, then it's going to go into the skin more easily. If it's flat like this, it's going to hurt. If it's damaged and broken, it's going to damage the skin. You're actually going to scratch the skin. And then if there's any type of bacteria in this area, because if you take the tip off, then infection can actually get into the needle. So you're not only are you scratching and irritating the skin, but you're inviting infection into the surface of the skin. So we're very, very careful about the needles that we use. So here's an example of a good, a bad, and an ugly needle. So good means it looks like this before insertion. Bad means that depending upon the quality of the manufacturer and the way that that needle is actually honed, if it's not honed properly, or then you're not going to get a nice sharp point. And then bad, this is really just disgraceful, and no company should be allowed to produce needles like this, because it can cause pain, bleeding, and potentially infection due to bacteria accumulation in that surface tip, in that open area. And they exist, believe me, they exist. Cheap needles do not, be really careful about the needles that you use. So again, Kamwo carries all of these. What we love are the Siren needles. They are medical grade stainless steel used for the needle shaft. They're triple polished. They're cleaned with an ultrasound and bathed of alkaline acid and waste to remove foreign substances even before they're sterilized. And then, I mean, they're just perfectly rounded. They're beautiful needles. The J15 line is designed for cosmetic facial treatment. They're a little pricey, but that's why. Then there are intradermals that Kamwo also carries that are great for you can see right here for wrinkles. They're lovely needles. They're double Japanese needles, double polished, stainless steel. They're specifically designed for cosmetic acupuncture, and they come in 3 different widths and thicknesses and lengths. So there's gold for very superficial areas. There's copper for areas that are a little more fat in them. And then there's silver, which are for very sensitive skin. They have a little bit of a silicone coating for people that are slightly sensitive to the needles themselves. And then exciting news, Siren is coming out with a new line that's exciting for us. It's the Alipus needles. These are actually a form of an intradermal needle with the classic Siren handles that are specifically designed for intradermal use. And again, true to Siren quality, they are surgical stainless steel, triple polished, cleansed, and with ultrasound. They're sterilized with ethylene gas to maintain the integrity. And what's nice about these is they come in blister packs of 5, so that you can fold the pack back, and it has a little crease, so you can actually put it down on the bed or on your table, your cleaning field, and then you can just pull them out. They're lovely. They're absolutely lovely needles. I can't wait till they come on the market. And then right now we have Pinex, which is another type of needle. So rather than going in horizontally, it's going to go in a little deeper. So you might want to use that for, say, the surface or deeper areas. There's surgical stainless steel shaft, patented plastic case. You flip it back, and then there's an adhesive tape that's safe to use on the skin. It's a hypoallergenic latex-free adhesive tape that allows the skin to breathe. And it comes in multiple colors. The outside package is different colors, and each of those colors represents different lengths and thicknesses and diameter. So say the orange ones are the shortest ones, 0.3 millimeters, and they're a little bit thinner, whereas the longer or the pink ones are a little bit longer. So you can use them, say the orange for the surface and the pink for deeper layers down into the muscle area. So just to recap, when we treat, so noting that the wrinkles are actually just the symptoms of the underlying pattern disharmony, and we are doing our diagnostic skills. We're treating the underlying pattern disharmony with our body points. And then we're going to treat the branch symptoms with face points. So we're going to put the body points in first, right? The lower points, the extremities, the upper extremities, the torso, the neck, and the face. And then we're going to remove them in the opposite direction. So we remove the head first, head, neck, and face first, then torso, then our extremities. So just to give you an example, here's a little film called Putting It Together. And let me see if I can get this to play. Here we go. So you can watch it and I'll just talk you through. So again, did my diagnostics. I'm needling first the feet. So, and this is just, this isn't a specific to a condition, although I do know this patient and she has, her primary complaint was wrinkles between her forehead, between her eyebrows and around her forehead. So just from doing my underlying diagnostics, I know that she has some liver qi stagnation and some digestive disorders. So we're going to treat her digestion as well as her liver qi. What I try to do is as few points as possible, because believe it or not, most people don't love getting needles. And so if you're starting at the base, the legs and the arms, and you're putting your needles in, by the time you get to the face, you may not have be able to put in a huge amount of needles without them hitting the wall, like saying, oh my God, I can't, starting to scrunch and tighten up around it. So again, I try to be as efficient as possible. So as you can see, I just did a few needles, and then now we're going to do the face. I did open up the back of her neck. She was having a little bit of a headache and neck pain. So I did do some points in the neck area just to open them up on one side, and I'll do the other side as well. And in more in-depth classes, there are specific reasons why you would use neck points and what you would use them for and how to use them. But this is just an introductory class. So I opened up her neck first. And you can see she just tightened her lips a little bit, and you can see this area right in here. This is the beginning of collagen loss. So I'm going to treat this area, but I'm also using stomach 4 because remembering that all the face muscles of the neck connect to the corner of the mouth, and quite enough, all of the muscles of the lower face connect at the stomach 4 area, as well as a number of mid-face muscles. So it's really a very important point for facial acupuncturists, and most of us use that point most of the time. Stomach 7. I'm using stomach 7 because the facial nerve runs through there throughout and the vessels, a lot of vessels run through. So one point addresses the upper face, the mid face, and the lower face. And here we're getting right into the corrugator. So as you can see, she does have a little bit of creasing right here. This was a concern for her, and then across the forehead as well. So we're using specifically treating the muscle area, the corrugator, which is the muscle that is responsible for the contraction of muscles around the eye. So you can see the change of the angle of those needles into the muscle layer at 40 to 60 degrees, whereas the other needles were more perpendicular as a meridian treatment. There was some creasing around the outer edges of her eyes that she was concerned about. And again, needling at that 40 to 60 degree angle to soften the corrugator muscles to relax the creasing between her eyebrows and across her forehead. And you can see it took me a little while to get in. That was a nice tight muscle. It really needs to relax. And here we go. So this is needling into the crease area. So you can see how flat that is. That's like 10 degrees, and it's a little difficult to see, but it's almost laying flat on the surface of her skin. And you can see the crease. You can see that I'm actually going right into the center of the crease, and I'm holding the surface of the skin because I want to feel the needle under the surface. If it goes too deep, then it's missing the target. It actually needs to lie flat on top. So I'm going to hold the skin. I'm going to drive the needle in, but I'm also feeling to make sure that I'm at the skin layer and not into the muscle layer. And then stomach 8 is a really good point into the meridian. So that would be, that's a sample of how to needle into the layers of the skin. And it's dependent upon the intention of your treatment. Great. So that's going to conclude my presentation for today. If you are interested in more information about cosmetic facial acupuncture, if it's something that you are interested in pursuing, the academy that I own is partnered with the Pacific College of Health and Science. We're offering a program called Facial Applications for Cosmetic Enhancement, or the FACE program. And what's nice about the FACE program is it's not just my technique, but it's the technique of leaders in the field. So last year we had myself, we had Matt Callison, Mary Elizabeth Wakefield, Michelle Gellis, Deirdre Courtney from Ireland, and Carrie Hart. It's a combination of virtual learning. So the didactic portion is online, and then there's a hands-on portion that you would go to either New York City or San Diego for 5 days of intensive clinical training. Because it's affiliated with the school, there's financial aid available. If you want more information, we will be offering a free webinars about the program where you can ask questions and learn more about it. If you are interested, you can email the school at face@pacificcollege.edu, or you can read more about it at pacificcollege.edu/face, or you can call them directly. And then if you have other questions about today's presentation related to the presentation today, you can certainly contact me at my website, www.hamptonsacupuncture.com, or you can follow my posts on Instagram at Shellie Goldstein, Shellie_Goldstein. So that's all I have to say. So I am very happy to spend the rest of tonight answering any questions that you might have. So I am actually going to stop sharing my screen, come on, and I see a couple of questions, but we're also going to allow time for people to ask whatever questions you might have.
Right. If you have any questions, if you can please raise your hand, and we'll get the in order. So we have one question from Tamara. Do you want to unmute and ask your question?
Sure. Hi. I have a mother who is someone that has nickel allergies, and I think she's reticent to try acupuncture for that reason. So
Yeah.
I'd like to know more about.
Absolutely. You can use surgical stainless steel needles, and it's so funny because I took the slide out that talked about nickel, but needles are made of different stainless steel needles are made of different amalgams, and probably Thomas can actually talk about this as well because he kind of knows about the needles. But some needles, yes, people who have nickel allergies would need to use surgical stainless steel needles because the primary reason for them is that the nickel has been reduced and removed specifically for nickel allergies. So Thomas, do you have any more specific information about
Yeah, I know that some of the needles are is amalgam with nickel in it.
Mm-hmm.
But yeah, there are stainless steel needles. I think the syringes are, I just don't quote me. I would do a little research on that just to make sure.
Yeah.
You email me or you email Shellie, I'll get the answer from Siren, and then we just, before I give any information out, I just want to be 100% sure.
That is a concern, and it's a really good question. But again, yes, it's and she may be, is she allergic or intolerant as well? Because that may be a question too. If you put the needle in to the surface of the skin and it gets very red and very itchy, that could be an allergy to the amalgam or to the nickel in the needle amalgam. If it just turns red without the itchiness, that might just be a histamine reaction. But you certainly, if it's itchy, take it out. And really, Siren is just by far the most well-developed, well-maintained, highest quality needle that you can possibly buy. So you might want to start with that, say on the hand, the back of the hand, or something like that. But yeah, Thomas, that'd be great if you can.
Yeah, sure. I'll follow up with that.
Thank you. Good question.
Thank you. There's a chance I could slide another one in. I have one more question.
Absolutely, go for it.
Thank you. And I might have to circle back because I just got embarrassed and lost track of my train of thought on that. So let's good enough.
The thing about questions is there are no bad questions, because what you're asking, others are probably thinking but don't want to say.
Yeah, I can't think of it right now. I'll come back. Sorry.
Okay, that's okay.
Is there anyone else with any questions? Okay, if not, I'm going to sneak in my question in there. Shellie, I have a part clinical and part practice management question in regards to facial acupuncture.
Okay.
Maybe you can speak to your experience with it. Would you ever combine treatments with the patients coming in for other issues other than facial acupuncture? Would you combine them, or would you actually do them as a separate treatment? Because you're actually doing a lot more work. So from the practice management side aspect of it, so
Right.
that's one
Yeah, good
question.
question.
And then from the clinical aspect of it, will it affect, because you're moving a lot of chi, will it affect the treatment on the face? So that'd be more the clinical aspect of it.
Right. So in terms of treatment, we do a fairly stringent and lengthy screening. It takes energy to move energy. So if someone is weak, debilitated, has been very sick, we probably would recommend several rounds of just straight up acupuncture. The reason being is they need it, but also the results, you're not going to get as good a results if someone is very wan, right? They need to be stronger. That could be, chi or blood deficiency. Once they are okay for acupuncture treatment, you're treating systemic in order to affect the surface treatment. So, and the stomach channel is the primary channel that runs through the face. Who doesn't have digestive issues, especially as they're aging? So you're always going to, not always, but I would say 8 out of 10 times, you're going to do a lot of treatments for strengthening digestion in order to lift the entire mid-face area. Pain, if someone has chronic pain, well, pain shows up on the face. We feel, you have to remember that the primary areas of the face, the orifice is your eye. You see things in the world, you smell things in the world, you taste things in the world, you hear things. So, and when you are in pain, it goes right into your face. You clench your jaw, you grimace your face. And so in order to really be an effective facial acupuncture treatment, you actually have to address the pain. If it's chronic pain or severe pain, again, that would be a situation where I would recommend waiting for facial acupuncture until we get you out of pain, from a practice management perspective, but also for a clinical perspective as well, because you want to, in general, facial acupuncture treatments cost more than a regular acupuncture treatment. So you want them to get the best effect that they can get. And you want to do the best job that you can do too. So it's a discussion that you have with your patient. You may want to, if the patient's in a hurry, because you will get patients who want to come in 5 weeks before their daughter's wedding or their own wedding or somebody's some major event, and they want to look their best, and they're like, okay, fix me. Oh, and by the way, I have severe sciatic pain. Like, Thank you very much. So you may, given the situation, you may say, okay, well, I will work with you with facial acupuncture, but then you need to come in twice a week and I'm going to address your pain too. So it's a clinical judgment. It's a discussion that you need to have with your patient and an agreement that you have, because there's also the financial factor as well. Maybe people can't afford to do both. So it really is it's both a ethical question that you're asking, but it's also a very important question to or discussion to have with your patient, just in terms of outcome and everything else, because you know, again, you want them to feel their best and look their best.
Okay, great, thank you. Nina, I think you have a question, right? Is that, you want to unmute and ask your question?
Hi, Nina.
Yes, hi there. Well, the question is, if I don't think you are in New York, Dr. Goldstein, you must be in the Hamptons, or
Yeah.
I am not a practitioner myself. I found the subject very interesting, and I've been doing acupuncture in the past and recently, not a lot really, but practitioners in New York that that you would recommend, of course, people.
Where in New York, Nina? In
Well,
the city?
in the city, yeah.
In the city? Yeah, there are quite a number of them. Carrie Hart, who's one of the instructors in the program, is in New York. She's an excellent practitioner. And then if you want to email me directly, then I can help you even more.
Sure. Are you are in the Hamptons? You live you don't live in New York.
I spend my summers, I spend my summers in New York and my winters in Florida. I'm very lucky.
Okay.
Okay, yeah,
Great.
thank you.
Thank you.
Okay, anyone have any other questions?
Tamara, I think you found your question, right?
Yeah, Tamara, you want to unmute?
Okay, thank you. You know, a lot of time, I think a lot of this will probably come up in your FACE class, and I'll do my research on that. But if you wouldn't mind, just general comments. As I was taught in my acupuncture training school, they had us do, pore opening and all this other sort of cosmetic type treatments. People all the time are talking about the use of hyaluronic acid and other products. They take collagen in order to try and strengthen, through their diet and so forth. Does your program cover any of those things? Are they worth
All of it. It covers, because everything's important. It covers much more in depth of what we went over today, both in terms of Eastern medicine and Western medicine. And then it also covers skin disorders. It covers what your patients will ask you, like skincare, different skincare regimens. We talk about hyaluronic acid, we talk about collagen, we talk about all of these things, because as part of clinicians, we also need to be able to speak the language of our patients, and they will ask you these questions, and you need to be educated, you need to be informed, and you need to know exactly what they're talking about. We talk about surgery, cosmetic surgery, what's out there, and what happens, and how we can interface as practitioners to either facilitate that. It's up to 100 hours of continuing education credit that you can get in NCCOM, California and Florida. So it's 14 weeks, 4-hour classes, the clinical component, and then the case study course. So it's extraordinary. We learn about research. We learn about how to write a case study. You'll have to do a case study as part of the graduation. So it's extraordinarily in depth. When you finish, successfully complete this program, you are really an expert in the field, and then you just need to practice.
Thank you very much.
Anybody else have questions? If not, we're going to wrap this up, and we're going to let Shellie enjoy the rest of her evening.
Thank you. Thank you so
Okay,
much.
great. Thank you, everyone.
was great.
Thank you for attending today's meeting. So please, if you have not done so already, please email events@kamwo.com So someone on the other end will send you a $20 coupon for for attending today's class, and be sure to check out more exciting events coming up on our meetup.com. Okay, great, from our group. Okay, thank you everyone for attending, and Shellie, thank you again on behalf of the group. Thank you very much for sharing. Appreciate it.
Thank you for having me.
Okay,
I
great.
appreciate it.
All right,
All right,
goodbye,
take
everyone.
care. Bye-bye.